Hello and welcome to another exciting episode of The Medical Moment. I'm your host, Dr. Valerie Walker. Today we're going to talk about a disease called Alzheimer's disease. A lot of times in the old days, I remember a keychain that used to be out, and I had one myself, and the keychain said, "Of all the things I miss my mind the most." Well, a lot of times people thought that was a funny little keychain, but if you have Alzheimer's or you are a caregiver taking care of a person with Alzheimer's disease, this is not a laughing matter. So you ask, so what is Alzheimer's disease? Where does it come from? How many people got it? We're going to address all those questions for you today. First of all, it's estimated in the United States that there are 5 million people out there with Alzheimer's disease. It's the 7th leading cause of death in this country, and actually for dementia, it accounts for 60 to 70% of all dementia patients. So Alzheimer's, it increases as we age. You're more prone to it. Even though it's a younger part of Alzheimer's disease, it usually strikes people sometime in their 30s, 40s, and 50s. For the purpose of this discussion, we're going to talk about Alzheimer's that usually strikes over the age of 65, or like my grandmother used to say in Georgia, old-timers disease. So Alzheimer's disease. First of all, it's a neurodegenerative disease, which means the brain itself has neuron cells in it, and these cells begin to deteriorate and they can't communicate with each other in a proper way. And also there are 2 proteins that's associated with Alzheimer's disease. One is called beta amyloid, and this causes all these plaques to accumulate in the brain. And the second one is tau, and what it is, it's a protein that just causes all these fibrillatory tangles to go on in the brain. So guess what? I hate to tell you, everybody has a little tar and some amyloid plaques in their brain. But for some reason, patients with Alzheimer's disease have more than others. And what happens over time, and people don't understand, well, what happens to patients with Alzheimer's, and why do they have to die? Those plaques and those tangles initially target the memory part of the brain, but as it progresses, because it slowly progresses, it starts attacking other parts of the brain, and wherever they attack that brain and that function, that's what you would begin to see. That's why a lot of times the cause of death in Alzheimer's patients is things like aspiration pneumonia, because they're not swallowing correctly. So just wherever those plaques and tangles attack the brain, those are the things that you're going to start seeing. So I thought I'd give you right now just some examples over the years of things that patients have told me about their loved one with Alzheimer's disease. And one thing that rings out with me very, very well is that patients with Alzheimer's often repeat the same thing over and over and over again. And I don't care how well you assure them, they still repeat the same thing over and over again. I had a patient told me, her daughter, that her mom called her every day at work and wanted to know where was her $100 bill. And she would tell her and try to reason with her that, no, mom, I don't know where your $100 bill is. And said 5 minutes later, she almost lost her job. They would call back and say, where is my $100 bill? So that's one scenario, is that a lot of times patients with Alzheimer's, and it depends on what degree they are. Everything in medicine, a lot of times we base on degrees. We say as mild, moderate, severe. So in the earlier stages, you may not recognize a lot of this stuff, but as the disease progresses and more of those amyloid plaques and tau proteins accumulate, then you'll start seeing more and more symptoms, and you'll notice that person start deteriorating every day a little bit more and just a little bit more. And another story a patient told me about is that her mother would eat. She never forgot her name, but she would always eat her dinner, and after she ate, she would say, when am I going to eat? And she would reassure her mother, you just ate. And then she would ask her, when are we going to eat? She would answer that over and over again. And then one of the saddest stories I know about is one patient in particular. Every day, because she was one of those church ladies, love the Lord, love to go to church, every day she would get dressed because the church bus used to pick her up. So every day she would get dressed and go sit on the front porch and wait on the church bus bus to come and pick her up. Well, naturally, the bus only got there on Sunday to take her, but her daughter said after a while she just stopped. She let her get dressed and she let her go sit out there because every day she wanted to go and sit on the porch and just wait on the bus. Another story I can remember in particular is a lot of times when Alzheimer's patients, that's why you got to be real careful with things like doors and door locks and stoves and all. They'll leave the home, but then they'll get somewhere and they'll forget how they got there. They won't know where they're home. And now this could be a store they've been going to for years and years and years, and they'll forget where the store is. And one patient said every day they start looking out for their mother because she went to the store and told them, mother's going to come here, but chances are she's not going to realize how she needs to get back home. So those are just some scenarios I just wanted to paint for you to just see and let you see the severity of this thing, because it's not a joke, it's not funny. Holler at them. A lot of times I have patients say they tell their parent or whoever they're the caregiver, whoever they're taking care of, don't you understand and all that? Well, guess what? They don't, because you got to keep remembering these two proteins, beta amyloid and tau protein, they're taking over the brain with these plaques. And later on I'll tell you about research and things we're doing to try to make this better. But for right now, hollering and telling them it's me when they don't recognize you anymore, it's not going to change a thing. They still won't wake up tomorrow morning and recognize you. Now, what are some of the risks of getting Alzheimer's disease? Well, one thing we do know, it runs in families. And that's why I always tell families, you got to know the family history. Please sit down and have a family party and everybody discuss what's going on with them, because if you know what's going on in your family, even though right now we do not have a cure, let me make that straight. We don't have a cure for Alzheimer's, but we can do some things to kind of prevent it from progressing if we start showing signs of it. So number one, it tends to run in families. Also, we know it happens as we age. It gets more and more prevalent unless, like I say, you have the young age onset Alzheimer's, and that's not our discussion, even though they got similar characteristics. We're talking about the older age. It happens more as we age and get older. And what happens is it starts out gradually, and guess who notices it the first? Believe it or not, is the patient. Because guess what they'll start doing? They'll start doing little things like writing little notes to themselves, little things to help them remember, because they can go in a room and just stand there and don't even know how they made it into the room. And that's some of the milder cases when the symptoms first began. They'll go to the store and forget what they went to the store for, forget where they put their keys, and that's usually still in the mild phase of it. As the disease progresses, and like I told you, it's progressive. It don't just stay still. It moves. It gets progressive year after year and year after year. You'll notice other things, like the person, like your mom or dad, is having problems with language and speech. They also have problems making good and right decisions and poor judgment. So you've really got to come in and help them with all the decisions that they make. And another big thing I see with Alzheimer's patients is a lot of times these are ladies and men that are used to being neat and sharp and dressed up all day long. A lot of times then the hygiene goes and they don't want to take a bath. And one patient called me and said, Dr. Walker, I don't know how I'm going to get mother in this bathtub because she don't want to take a bath. And this is a mother that's taking 2 or 3 baths a day. That's how much she loved to bathe. So we have problems with the hygiene. Then we have problems with them formulating sentences, like whole sentences, and being able to carry that sentence all the way out. Their thought process kind of can wane and go off. They can start thinking things that's not true. They can start having hallucinations. I had one patient tell me that her mother insisted that she had her $100 bill, that she knew she had a $100 bill, she got the $100 bill, and she want her $100 bill. And so every day she would just pound me again and again and again about that $100 bill so they can get fixed on one thing. Or what day is it? What day is it? What day is it? What day is it? They'll keep asking you the same questions over and over and over. And I don't care how many times you tell them what day it is, guess what? They're going to ask you the same question again. And they again, just keep always remembering, I'm making it real simple, is these 2 proteins, beta amyloid, and there's probably other factors too. We have scientists working on this stuff every day, trying to find a cure and trying to make us better. But those proteins, as they attack different parts of the brain, you'll find different things start happening to your loved one. It gets to a point when it gets way down to stage 3. Sometimes they can't get out the bed. They're incontinent of their urine and their bowels. They cannot speak. The speech goes. And there again, that's because those amyloid plaques and that tau protein is mostly taking over the brain. So as it takes over the function, because the brain is the big boss now, the brain directs the whole ship. So as it goes down, so do the function of the body. So you ask, so what can we do? What will a doctor do? When I take mama to the doctor, what'll happen? Well, the first thing the doctor's going to do is try to talk to you first, to try to find out, well, exactly what is going on. Then they're going to want to do all these series of tests, checking things like their cognition, how they're thinking, how they're function, their intellect. They'll do all these intelligence tests on them just to see what they're working with. And a lot of times we have to do labs to rule out other things, meaning let's make sure this is all we're dealing with. It's like a diagnosis of exclusion, as we call it in healthcare. Diseases like thyroid disorders can mess you up some, so we want to make sure the thyroid is okay. We can do a test like an MRI. Now the MRI will not just come back and say, oh, well, your loved one has Alzheimer's. It doesn't do that. We do an MRI a lot of times to rule out what it isn't, like to make sure that patient has not had a stroke or some big brain hemorrhage and all that. Even though researchers, especially in university settings and teaching hospitals, they're using things called PET scans to try to, they use tracers to go through the body and identify a lot of the things going on. We have research now trying to measure amyloid and tau in the blood to see if that's a precursor for what is going on. So we got all these things ongoing, but it's just not a diagnosis. You just walk in and say, oh, they have Alzheimer's. We have to rule out all the things. Vitamin deficiencies, like B12 deficiencies, can cause you to have problems similar to this. So your doctor's going to run blood tests. They may or may not do a CAT scan, MRI, just depending on where they are, to try to narrow this thing down to Alzheimer's. And once we've narrowed it all the way down, then we got to see what are we going to do about it. Well, the first thing we got to look at is the caregiver, because guess who works very, very hard in these difficult positions, because it's very hard to have a loved one like a mother or parent that you love a lot and you know they love you and look at you and they don't even recognize you. The care gets kind of tough because, like I said, toward the end, a lot of times they get incompetent, they urine, they stool, all of these things. Sometimes they can't eat, you have to feed them. So the first person we got to take care of in this scenario actually is the caregiver and get them together. And then the next thing we need to look out to is things like the Alzheimer's Association. They have all kind of resources and ways that they can help to make this thing go smoother and to help it go better. Medication wise, we don't treat on this show. We only tell you what's out there. There are medicines that can control like their mood and things that's going on, like they can suffer depression, anxiety, agitation, get real agitated, they can get real mean. I mean, the spectrum just goes on and on and on of what can happen in patients with Alzheimer's. So what we want to do is control those symptoms. We also have medications that can slow the progression of their cognitive decline, but it's still not a cure. Right now we have no cure for Alzheimer's, but like I said, we have scientists working around the clock trying to find a cure. And just a note, I want to give you a little fact that you may not know. People with Down syndrome, trisomy 21 as we refer to it, and most of you know somebody who has Down syndrome. That's a whole nother show we'll do in the future. They most always get Alzheimer's disease. And there again, we're looking into research to see why is it true. It may have something to do with the beta amyloid, but we're looking into it to see why do people with Down syndrome wind up with Alzheimer's disease. So what we've got to do, we've got to pay attention, number one, to the caregiver. Make sure they're getting all the support they need and can have. We need all the family members to pitch in. You family members who leave it up to one person to do do everything. Don't do that. You're going to need help with this. We want to make sure we got the correct diagnosis, and we have to be as supportive as we can. It's very common in this country. Like I said, over 5 million people so far. 7 leading cause of death in this country is Alzheimer's disease. So let's be supportive. Let's be caring. Let's recognize the symptoms, because actually patients with Alzheimer's, their recent memory will go, but guess what? Their remote memory will stay intact. You can ask them something about their childhood and they'll be able to tell you that. But if you ask them what they did a few minutes ago, they won't be able to do it. So the remote memory a lot of times will stay intact, but the recent memory will not. So if you or someone you love, know anybody that may start exhibiting these signs of memory loss, remember that's the first area that it attacks is your memory, then you want to talk to your doctor and talk to your family and get that patient all the help that they need. This is Dr. Valerie Walker, and this has been our story on Alzheimer's disease. We'll see you next time.